Michelle. I can't find it.
Have you checked the doctor's desk?
I checked it.
His briefcase?
Yes.
His car?
Yes.
And the trunk?
Yes.
How about the men's room?
No.
It happens more often than any of us cares to admit. When you add up all the time we spend chasing paper of one sort or another, it's astounding. Here's a way to stop the paper chase. AllScripts My Way gives you instant access to all the information you need when you need it. You can make the transition to electronic health records and still practice medicine the way you want. No steep learning curve, no hiring of IT people to make it work. The first thing you'll notice is the familiar workflow. The tabs flow from the left to the right, from history to review of symptoms to physical exams to diagnosis, working just the way you do.
Great, so that's our plan. I'll see you next week.
Oh, Doc, yeah, there is one more thing.
Patients don't always have just one complaint, and they don't always follow a particular order when telling you about those issues. The thing that impresses me most about AllScripts My Way is that it gives you fast access to any information, any resource, in any sequence you need it. This system allows you to identify any number of complaints. In this example, here's the knee pain, which was the acute symptom, along with the chronic problems of diabetes and some palpitations he's having from his atrial fibrillation. You can quickly go from the specific questions you want to ask about the knee pain to the questions about his diabetes and the atrial fibrillation without bringing up a template for diabetes or heart disease. You'll be reminded to check A1C quarterly or do EKGs and check triglycerides. The ability to document multiple complaints not only sets AllScripts My Way apart, but it helps make sure patients get follow-up for those conditions, which means better care for them and more revenue for you.
What seems to be the problem?
Well, it's my head. It's like there's this conflict with the extra code for an SC4 beta, so the compiler generates this runtime error that the diagnostics didn't catch. It's like that.
So you're having headaches?
Well, yeah, I guess that's another way of putting it.
Sometimes getting information from a patient is difficult enough. AllScripts My Way makes the electronic charting of that information as easy as it can be. In fact, the more you use it, the more it adjusts to your habits and patterns. When you go into history of present illness, for instance, abdominal pain, you'll see location and quality. If sharp intermittent pain is one of the questions you ask frequently, you can select it here and move it to the top. Now when you refresh, you'll notice it appears at the top. So it's easy to use, easy to understand, even when your patient isn't.
Hello?
Are you serious? No, you are out of your mind. You're crazy. Oh my God. I would have never guessed that. I would have never guessed that. Oh, Jackie, hang on. Hello? Hey, no, I'm on the other line. It's okay. Really? What about, well, no, I can come with you. I can totally help you pick out a dress. That's fantastic.
There are certainly inefficiencies we can't improve, but there are so many that AllScripts My Way can. AllScripts My Way gives you the most efficient way to write, send, and refill prescriptions. And it lets you provide comprehensive patient education. That means fewer callbacks and better compliance. So even if the patient is focused on other things during the exam, you can get your job done and the patient gets what they need quickly and efficiently. There's no smoother way to make the transition to a digital practice than AllScripts My Way. It's a way to create a seamless flow of information from the front office to the exam room to the back office and beyond. It lets you focus on practicing medicine the way you want.